Welcome, I'm Dr. Kelly Morgan, a research fellow based in Decipher at Cardiff University. And during this presentation, I'll talk you through findings of an evaluation of the long-term impact of participation in the National Exercise Referral Scheme. So despite the well-known benefits of being physically active, at present, roughly 42% of adults are inactive in Wales. So that's roughly 1 million adults who exercise less than 30 minutes for 5 times per week. So inactivity is shown as the 4th leading risk factor for mortality worldwide. And this is actually associated with up to £35 million worth of costs for preventable diseases each year for the NHS. So as such, a global public health priority is to increase physical activity at both the individual and population level. So one method which is commonly used throughout the UK is an exercise referral scheme. So at present there's over 600 schemes in the UK. And here in Wales, we have a National Exercise Referral Scheme, which was introduced in 2007. So typically, the programme involves a health professional, so for example, a GP, who refers a patient to the scheme. And the scheme is a 16-week programme of supervised group-based activity, typically at a leisure centre, and it has planned follow-ups. So a patient will meet with an exercise instructor and have a series of consultations to check in with how it's going. So the exercise scheme in Wales has shown positive impacts on both health and physical activity outcomes. This was through a randomised controlled trial back in 2012. And since the positive findings, the scheme has now been rolled out across the whole of Wales, so in each of the local authorities since 2012. A patient's journey and interaction with the National Exercise Referral Scheme can vary considerably. So for example, a patient may visit their GP, and at which point the GP may refer the patient towards the scheme, or they may decide that a referral is not necessary. For those who are referred, there are a proportion who decide, or for some reason or another, do not take up the scheme. There are those who go on to complete the 16-week programme, and there's also individuals who drop out during the 16 weeks. For the individuals who complete the 16 weeks, they may go on to be still active at 12 months, or alternatively, they may discontinue to be active after the scheme finishes. So this project looked at data between 2008 and 2017 to really uncover rates of referral, uptake rates and completion rates. So who is being referred to the programme? Who is actually taking up the programme? So for instance, wider research has shown that women and older patients are more likely to take up exercise referral schemes. We were also interested in who completes the programme and how many people complete the programme. And then finally, we have been interested in what are the longer term health outcomes and health service usage for patients who are referred to NERS. So in order to examine these questions, what I have done is looked at data provided by the programme itself, and this is all anonymised data, which has been linked up within the secure anonymised information linkage databank held at Swansea University. So essentially, for every patient who's taken part in the exercise scheme, I have tried to link them to their routine medical records. So for example, their general practice records, their hospital admissions, their medication usage. And this very crude diagram here just shows that I had data on roughly 180,000 individuals. And by the time I'd linked them to the medical records and their study data, I was left with a sample of just over 83,500 individuals. And this was a slightly more complicated process, which is shown in this diagram. But this is just to give an overview, really, of the processes which are involved in linking routine data and how I came about to my final sample of patients. So first of all, looking at referrals and uptake of the scheme. So this project was concerned with patients referred on a generic pathway only. So patients who were sedentary and shown to be at risk of developing a chronic condition. So to date, roughly 83,598 patients have been referred to the programme, and these are patients who've only been referred once. So I wasn't looking at patients referred more than once. Over 2/3 of the patients have taken up the scheme, so they have attended at least the initial consultation, if not taken part in the exercises. And what I was looking at was, can we find characteristics of those people who took up the scheme and those people who didn't take up the scheme? So the information shown here has accompanying odds ratios. And we can see that patients who were older, who were referred for a musculoskeletal condition, or those referred for a level 4 condition, and those tend to be more complex conditions, they were more likely to take part in the scheme than younger individuals, individuals who were referred for other reasons. And then moving across, we can also see that males were less likely to take up the programme. Patients who were more deprived, so we found a linear relationship here. So as the deprivation level increased, we found that the likelihood of those patients taking part in the scheme decreased. And similarly, we also found that patients referred for mental health reasons were also less likely to take part, as you can see, an odds ratio of 0.78. In terms of the numbers completing the scheme, so just under half were found to complete the 16-week exercise programme. And those more likely to complete, again, were older. They were level 4 referrals. And we also found an association with the type of referrer. So compared to referrals by a general practitioner, individuals are more likely to take part if referred by a physiotherapist or other professional. And those rating themselves with a higher health score at baseline were also more likely to take part for the full duration. Conversely, again, we find that younger individuals, those in the most deprived areas, those with a mental health referral or those identified as having an anxiety or depression issue at the start of the programme, were less likely to complete. In order to examine the longer term outcomes for individuals referred to the programme, we have used a statistical approach called propensity score matching, whereby we have matched each NERS participant with a member of the general population who has not been referred to the programme. And we've matched them on characteristics such as age, gender, and their deprivation levels. Our findings showed that we could match just over 48,000 patients. However, we also found that there was a higher number of existing comorbidities in the NERS group compared to our matched control. So at present we have a biased cohort of which we're now trying to identify alternate ways of matching. So to conclude, our findings have provided an insight into the individuals who are both referred and have been using the National Exercise Referral Scheme in Wales. And results have shown that patterning has been identified throughout the scheme, from referral through to completion. And we have noted a widening of inequality, both in terms of patient socioeconomic status and referrals for mental health. So these findings can be used to enhance our understanding of what longer-term impact NERS may well have and for whom. And ultimately, these findings can be used to help inform future decisions about NERS to ensure that the programme is accessible for all. Thank you very much for listening, and to finally finishing off with thanks to the wider research team and to the funders Health and Care Research Wales. Thank you very much.